Hello, my name is Paris. Today I will be presenting on this case is about NJ. He came into primary care office stating, "I am so worried all the time that I can't do anything else. I need some serious help." NJ is a 55-year-old male with a complaint of severe irritability, being on edge, unable to sleep at night. He always feels tensed, exhausted with muscle aches. He was laid off as a manager at a building supply store, unable to focus to complete job application, and has difficulty talking to people. He is afraid that his wife will leave him. He often complains of diarrhea and abdominal pain. He is in a constant state of worry all the time. He found himself at the ED because he was so worried about multiple issues in his life that he did not eat or sleep for 2 days. He left with a prescription for hydroxyzine but stopped taking it because of constipation. He's had multiple visits in the last 9 months for insomnia, headaches, abdominal pain, and diarrhea. Family history: his father was on nerve medication for most of his life, and his sister has a history of anxiety and depression. Unfortunately, the sister was also addicted to benzos, but since then she has been treated for it. NJ lives with his wife of 25 years. He was able to quit smoking 5 years ago and has been sober for alcohol for 10 years. This addiction to tobacco and alcohol could be how he coped with anxiety in the past. He also drinks 4 to 5 cups of coffee, which we know that the caffeine does not help with the anxiety. He also occasionally smokes marijuana for anxiety when it gets too bad. Medication-wise, he is allergic to sulfa and codeine. Right now, he is taking buspirone 30 milligrams twice a day, phenelphrin 10 milligrams 4 times a day for nasal congestion, and loperamide 2 milligrams PO every 6 hours for diarrhea. On his assessment, he had positive for some numbness and tingling, a little sweaty and clammy. His urine toxicology showed THC, but other than that, he had an unremarkable physical exam. During the mental statics exam, the provider noticed that he was jittery, gave fair eye contact, bouncy legs, and wringing hands. He was anxious, worried about everything, and so concerned that he was sick. So the medications that he is on is buspirone, which binds to serotonin and dopamine receptors in the brain. This increases the norepinephrine metabolism in the brain. The typical dose for this is 20 to 30 milligrams total twice a day, and is not recommended to exceed 60 milligrams per day. So right now NJ is maxed out on the buspirone, and he's been taking it for about 6 months. With the phenelphrin, he uses just to temporary for nasal decongestion. Unfortunately, the side effects are upset stomach, trouble sleeping, and nervousness. And for him, he typically always has an upset stomach, trouble sleeping, and nervousness. So the PRNs are something that should be discussed as far as whether he should take it going forward. The loperamide is used to treat acute diarrhea. When this is paired with antihistamines, it causes constipation and can increase CNS depression. So when he got the hydroxyzine from the emergency department, he stopped taking it because of the constipation. So loperamide and the hydroxyzine definitely would have caused more constipation, and I could see his frustration on why he decided to stop taking the medication after he was discharged from the ED. So let's talk about the Hamilton Anxiety Score. This scale was developed to measure the severity of anxiety symptoms. The scale has 14 items rated from 0 to 4. The items include symptoms of psychic anxiety, and then also the somatic anxiety, which is going to be the physical complaints. So the score can range from 0 to 57. The score 18 to 24 is mild to moderate. 25 to 30 is moderate to severe anxiety. And a score above 30 may be closer to the diagnosis of panic disorder. NJ scored 34. So to rule out panic disorder, that might be something the providers may want to do. But it does show that his anxiety is very severe. So here we have the definition from the DSM. As you can see, the severity of his symptoms are right here. He has extreme irritability, constant worry, insomnia, muscle tension, difficulty concentrating, restlessness, abdominal pain, and diarrhea. So let's talk about some of the treatment. There are non-pharmacological treatments. So as a provider, I would recommend that he start with a therapist. Good therapeutic techniques that he can get involved in will be cognitive behavioral therapy, which focuses on the triangle of thinking, feeling, and then behaving. So based on your thoughts, how does it make you feel? How does it make you act? Then there is a newer therapy called the attention bias modification treatment. And then yoga and meditation can also be some helpful modalities that he can use to help with his anxiety. So number one would definitely be the therapy. So let's get to medication options. Anxiety and depression have similar medications for these disorders. So we're going to recommend SSRIs, buspirone, and SNRIs. So the SSRIs, one example is escitalopram, which inhibits the reuptake of serotonin in the CNS. This is not something that should be taken with buspirone or MAOIs, and because that would increase the risk of serotonin syndrome. Usually they can start with about 10 milligrams PO daily, then increase 10 milligrams after that for 1 to 2 weeks, or increase the dose after 1 to 2 weeks. So the max dose would be 20 milligrams. With buspirone, this is a good medication because it does not lead to dependence or tolerance. This is what he is on already, and he's been on it for the last 6 months. So I don't know if I would take it away so far. I would still try to see if it's going to work with him, and suggest other modalities in adjunct with the buspirone. Some people would take buspirone for up to 2 years before they start to get results, but I think maybe 6 months might be a little bit too soon to change the medication before looking at other options to go with it. And then SNRIs, side effects are similar to SSRIs, where they can include insomnia and elevated blood pressure. But the SNRIs will block the reuptake of norepinephrine and 5-HT, which allows these neurotransmitters to bind with the receptors in the brain. So an example of this would be Cymbalta. So the initial plan would be to continue the buspirone, because again, he's only been on it for 6 months, but have not tried any of the adjuncts. So I would try to decrease some of the PRN usage, because the nasal decongestion that he uses will add to his nervousness. So instead of the decongestant, maybe use some nasal sprays and a neti pot. And then knowing that the loperamide can cause constipation, I would only use this medicine for emergencies, when he's continuing to have a loose stool, and then only use it for short periods. So to add to the plan, you definitely want to start with some therapy. Daily exercise at least 3 times a week. He can try some mindfulness and meditation. As far as his diet, he needs to decrease the caffeine significantly. He's drinking 4 to 5 cups, and probably if he reduces it down just to 1 cup, he'll have some better results. And then just work on some activities that decrease the stimulation. So as far as pastimes, don't do anything that's going to increase his adrenaline and make him more excited, and then make it difficult him for the comeback from that adrenaline rush. I also recommend a symptom journal that will help identify what leads to the increased symptoms of anxiety, and what leads to where he has those moments where he can't eat and sleep. So focus on what's happening through the day, what happened throughout the week, to discover what situations lead him to that extreme anxiety where he finds himself in the hospital. So follow up. This is very, very important for a prescriber. The prescriber must have open lines of communication with the therapist. They need to start, as far as patient education, I want to remind him how caffeine can increase his anxiety and his jitterness, and then also discuss daily exercise, therapy, do a symptom journal, and then when to seek emergency treatment for SI and HI. It's important that as a prescriber, when you refer your patients to therapy, that you give them at least 2 to 3 options, so they can find an option that works with them, their insurance, or just have someone that's going to meet their personal needs. So someone that they can build rapport with. There's some similarities to the styles and communication to make sure that it's a good fit. In this technological age, we use apps for many things. So we can also use apps to help with anxiety. So the Anxiety and Depression Association of, and then here are my references. Thank you for listening.